CDC is preparing to alert doctors about a mystery illness showing up in children which may be linked to COVID-19. It is causing concern among parents across the country as doctors see a list of unusual symptoms. Camila Bernal has the developing story.
A 12-year-old girl in Louisiana suffers a heart attack.
It kind of felt like I couldn't really do anything because I was in a lot of pain.
In New York, a 9-year-old boy recovers in intensive care.
He was just crying out in pain anytime anyone went near his belly.
2 different children in different states with different symptoms, but there may be one link: COVID-19.
As a parent, I can tell you, this is a parent's worst nightmare.
The CDC is expected to warn doctors to watch for a dangerous inflammatory syndrome in children that could be tied to coronavirus infection. Symptoms include persistent fever, rash, abdominal pain, vomiting, and swelling of the hands and feet.
We thought that children were not especially affected by the virus. To now find out that they might be, and it might be several weeks later, this is truly disturbing.
The illness is being called pediatric multisystem inflammatory syndrome, and the number of cases is rising.
I think having kids get this sick, having them get some of the deadly complications is just something that as a society we just can't bear to see.
And as doctors try to determine why children are getting sick, health experts warn it shows there's a lot we don't know about COVID-19.
We really better be very careful, particularly when it comes to children.
I'm Camila Bernal reporting.
And yesterday on First at 4, Kentucky Governor Andy Beshear talked about children in Kentucky with some of these conditions. And today, the Courier-Journal reporting Norton's Children's Hospital in Louisville is evaluating 2 children for possible cases of this condition. A 10-year-old was on a ventilator, and in the pediatric intensive care unit, a second child, 16 years old, is doing well after being admitted to Norton as a precaution.